why did you specifically choose to do spine surgery?
Yeah. It was really a long road. I mean, I think a lot of the stats, if you look at it, comes down to suggesting that about 80% of medical students who enter school have an idea of what they're going to be, but they're actually completely wrong. So they end up coming in thinking they're going to do one thing and they leave going into a totally different residency. And I was part of that 80%. Honestly, I had several changes in terms of what field and profession I thought I was going to go into. I ran, from cardiothoracic to ophthalmology. And for a long time, I thought I was going to be a surgical oncologist. And I remember one day I just was getting tired of a lot of the patients passing away so quickly on the surgical oncology side. And I said, you know what? I'm just not wired to, reap the benefit of giving these people a little bit more dignity in terms of, dying with some dignity. And so for me, uh, for going from that experience and then finding orthopedic surgery where you have somebody who comes into your office in a wheelchair, you do a hip replacement on them, and they walk out the same day, and you have right then in that moment changed the trajectory of their life for the next 20, 30, 40 years is really a magical experience that I think resonates with a lot of people who need some more instant gratification. And then I think the rest of it comes down to my time down in Atlanta. When I was at Emory, we actually had I was doing a lot of sports-based surgery. I was following a lot of the guys who were taking care of the pro athletes, but I ended up finding people who were just really great spine mentors for me, and the surgeries were really impressive. And that same characteristic of how a hip replacement can change your life. In medicine, we quantify that in a term called QALYs, but looking at how your life years can be impacted by simple events. With a simple discectomy, that's probably the next closest thing I would say to a hip replacement. And so the spine surgeries were just so awe-inspiring when you watch them, and you still got that gratification. So, along with some mentors, I ended up going into spine surgery at that time.
Yeah, I've talked about this before, but patient outcomes is something that not many people going into medicine really consider. They think like, "Oh, I'm gonna go into neurosurgery," and then they don't see on the outside that everyone gets admitted to the ICU, and they're very, very incremental stages in getting better, and sometimes they don't. And, like, ophthalmology, as you mentioned, and orthopedic surgery, when they wake up or even maybe few weeks later, their lives are changed because they can walk, they can see, they can hear, they do. Thank you so much for listening. I hope you enjoyed. If you don't mind, please leave a like and subscribe. And with that being said, see you in the next one.